Hello everyone. Today we will have obstetric lecture, and today we will see about the common diseases during pregnancy. One by one we will see the diseases, common diseases along with pregnancy. In that, first and very common disease is anemia. So anemia during pregnancy. Anemia is nothing but the decreased level of or lowering of the hemoglobin during pregnancy. So lower level or decreased level of hemoglobin during pregnancy, that we call as anemia. Now anemia, it is very commonly associated with the pregnancy because there is increased demand of the blood products or hemoglobin. Iron demand is very increased during pregnancy because of the growth of baby. So due to the increased demand and maybe due to decreased supply, as our diet is not complete, mainly commonly seen in developing countries, as we have deficiency in our diet, so that demand cannot be fulfilled by the dietetic supplement. So there may be a lowering or decreasing level of hemoglobin, and that causes anemia. So anemia during pregnancy. Anemia means a lower down or decreased level of hemoglobin. For that, you should know the normal level of hemoglobin, that is 12 to 14 gram percent. So for developing countries, they had given the level, that is 10 to 11 gram percent can be considered as normal hemoglobin, but below 10 or 11, it is considered as the anemia. So that is anemia, that is decreased level of hemoglobin during pregnancy, that we call as anemia during pregnancy. Now this is the basic for our topic. Now classification of anemia. Classification is usually depending on two types, physiological and pathological. Physiological anemia is the anemia which is commonly seen in the pregnant ladies, and it is because of the decreased level of hemoglobin, but it is very common as there is increased demand of hemoglobin. So there is decreased supply of hemoglobin, and this is physiological because the hemoglobin level is in the range of 12 to 14. If that female is having her hemoglobin, that is about 12 to 13 gram before pregnancy, and if it is decreased up to 11 to 12, then that hemoglobin level or that condition is normal, because there is not sudden decrease in the level of hemoglobin, or the hemoglobin is not below than 8 or 9 gram percent. So it can be considered as the physiological anemia. But if it is there is sudden decrease in the hemoglobin level, or it is less than 8 to 9 gram percent, so we can call it as pathological anemia. So we have two types of anemia basically, physiological and pathological. So physiological is commonly seen because of the increased demand of iron and because of the decreased supply, and that is physiological. Now we have to see for the pathological anemia. In pathological anemia, mainly anemias which are seen during pregnancy are deficiency anemia, and deficiency anemia are common is iron deficiency, second is folic acid deficiency, then vitamin B12 deficiency and protein deficiency. These are deficiency anemias. Next is hemorrhagic anemia, that is because of excessive bleeding during pregnancy. It may be acute, it may be chronic. So hemorrhagic is acute hemorrhagic, that we had seen about APH, that is antepartum hemorrhage, where there is detachment of placenta or there is lower implantation of placenta that causes severe bleeding during pregnancy, or any type of abortion where there is severe bleeding, or any injury, trauma, surgeries that causes excessive bleeding, sudden bleeding, and leads to anemia. Chronic, it is because of the slow type of bleeding during pregnancy, usually seen in the piles, other infections, cyst, rupture of any minor cyst or tumor, then other infections which causes bleeding, slow bleeding, sometimes perforations. So these things are seen in the chronic blood loss, and that causes chronic hemorrhagic anemia. All these things we had seen previously, so we have to see in detail about the deficiency anemia. Next type of anemia is hereditary anemia, that is again thalassemias and sickle cell anemias. And next is bone marrow insufficiency. Other anemias are because of the secondary diseases like malaria, tuberculosis, cancers, chronic renal diseases, chronic lung diseases. So these are the associated anemias because of the major disease in that female. These are the associated conditions, because if she is suffering from renal disease, if she is suffering from lung disease, then there are chances of lower level of hemoglobin. So these types of anemia are associated with the major diseases. So basically for obstetric we have to see for the deficiency anemia, as hemorrhagic anemias are associated with the conditions like APH, abortion, and chronic are also associated with some bleeding disorders, and others are totally medicinal disorders like sickle cell anemia, thalassemias, bone marrow insufficiency. Others are anemias along with the secondary infections or major diseases. So we have to focus on the deficiency anemia. So now anemia, which is because of the deficiency, and in that common is iron deficiency anemia. So we should know about the iron deficiency anemia. Now first is deficiency anemia, and in that causes of anemia. First and important cause is because of the faulty diet. As our diet have not proper, or it is not rich in iron or carbohydrates, protein, that leads to anemia like condition. So mainly it is because of the faulty diet. So we should counsel the patient during pregnancy, during our ANC sessions, about the proper balanced diet. The diet should be with plenty of fibers, plenty of minerals, plenty of green vegetables, fruits. All these things should be included in her diet. But as it is not possible in practical practice, but we should at least, proper counseling of patient is very necessary. Patient as well as her family members to have the proper balanced diet. So main is faulty diet during pregnancy. Next is due to iron loss, or maybe due to some blood loss during pregnancy, that may causes the anemia. It may be because of bleeding piles, maybe dysentery, maybe history of malaria, hookworm infections. All these minor infections or history of these infections may causes slow bleeding, but patient may, there is a very common type is piles. They are associated with pregnancy. Initially also there is slow leakage of blood, or there is constant blood loss during pregnancy from these piles, and that also causes anemia. So these are the small conditions we should take in the proper history. So again in ANC we should ask about the major or minor diseases, history of diseases, history of any major treatment taken before. So all these things we should know about the patient, and that slow leakage of blood may causes anemia. So second type is bleeding during pregnancy. Next is, as we had seen, there is diminished absorption. In some females there may be loss of appetite, loss of because of the socio-economic factors. Patient may have faulty dietic habit, she may have loss of appetite, vomiting, because of the morning, because some females have severe morning sickness and may have nausea, vomiting, and because of the faulty absorption of that food, she cannot get the proper nutrients. So excessive hyperemesis gravidum, that is excessive nausea and vomiting during pregnancy, that also leads to anemia. So we have to control the nausea, vomiting during pregnancy, as nausea, vomiting during pregnancy is very normal, but if it is excessive, that may leads to defective absorption of that female. What she is having her diet and all other supplements that are not absorbed because of the excessive vomiting. So we should give proper treatment for that. Next is because of the disturbed metabolism during pregnancy. In some females, metabolism is quite disturbed during pregnancy, and that may also leads to faulty absorption and may causes the anemia. Other is excessive or increased demand, especially seen in the twin pregnancy, as there is growth of two babies during pregnancy, in pregnancy. So there is very increased or high demand of the iron, and maybe because of her socio-economic factors or dietic factors, she cannot complete that and she may develop the anemia. So these are also the some types or causes for the anemia. Again, the important cause is age. It's below 18 or after 40. There is again a faulty metabolism, faulty absorption. So age factor is also very important for anemia. So pregnancy depending on the age, that is below 20 or after 40. Next is parity. Increased parity, multipara patients usually have the tendency of anemia because they cannot fulfill the demand of the iron supply for the growing baby. So multipara patients also quite easy to develop the anemia. So these are the common causes for anemia. Just to summarize, the causes are: first is dietic cause, faulty diet during pregnancy. Next is defective absorption during pregnancy. Defective absorption is mainly because of the morning sickness or nausea, vomiting. Then metabolism, faulty metabolism. It is maybe metabolism may be changed because of the age factor, because of the parity, because of the underlying disease. So defective metabolism is also seen. Then again some infections or history of major infection diseases, major medicinal treatment, these can also have the effect and may have anemia. Patient with having patient which are having history of major diseases, malaria, typhoid or other major diseases before pregnancy, or patient with history of proper steroids or many medicines before this pregnancy, so they may have anemia during pregnancy. Patient with chronic blood loss, especially from piles or any other disease, that also develops the anemia during pregnancy. So these are the common causes for anemia. Now iron deficiency anemia patient have clinical features. First is there is feeling of exhaustion, feeling of severe weakness, that is the first complaint from patient. Other maybe there is patient have dyspnea, giddiness, swelling on legs, but main is patient have severe weakness, fatigue. She doesn't have any desire to do the things, and daily activities are very slower down. So main complaint is weakness or fatigue, tiredness, and next is palpitations, dyspnea, edema on the legs, giddiness, sometimes nausea, vomiting. All these things are very common. These are the symptoms. Now signs on examination, we have the common signs, that is edema can be seen on the legs or extremities, and there is pallor is seen, clubbing is seen, icterus is seen, glossitis and stomatitis. These are also the findings with anemia. Signs of anemia as we are knowing. So all the signs of anemia we can see on the patient, but important is swelling on the legs, as anemia during pregnancy is associated with edema on the legs. This edema we should differentiate with the edema because of the increased blood pressure. Pregnancy induced hypertension, that is generalized edema, and this edema is usually on the legs. So these are the signs of anemia. Now this anemia is again divided into mild, moderate and severe grade. So mild anemia, it is anemia which in which there is hemoglobin level in between 8 to 10 gram percent. Moderate anemia, it's the anemia where there is hemoglobin level between 8 to 7%, 7 to 8 gram percent, and severe is less than 6 to 7 gram percent. So these are the grades of anemia: mild, moderate, severe. Mild, it is between 8 to 10, moderate less than 7 to 8, and severe it is less than 6 to 7. So depending on the grades of anemia, again the clinical features will vary. Mild to moderate clinical features are as we had discussed, there is feeling of weakness, fatigue, tired, feeling of nausea, vomiting, patient have dyspnea, edema, and pallor and all other things are seen. But in severe, patient is usually having severe dyspnea. Patient cannot do her regular work or routine work. Patient have breathlessness, severe breathlessness, palpitations all the time. Patient may have vomiting, severe edema. Edema is seen all over the body. And on examination, there is a murmur, which is usually a soft systolic murmur, which is heard. And this is present only in the anemia during pregnancy. So crepitations are also sometimes heard. Creps, that is the respiratory finding, which is usually seen or which is usually found in pneumonia, tuberculosis, and a particular paper rolling sound is heard, that we call as creps. So systolic murmur and creps during auscultation, these are the findings which are seen in the severe grade of anemia. Now these are the types of anemia, and clinical features are depending on these grades. Clinical features are depending on the grade we had seen. Now the lab investigations for anemia, as we all know, lab investigation is very common. So it is hemoglobin level, to check the hemoglobin. So by blood examination we can do the CBC examination, and on the complete blood count we can know the percentage of hemoglobin. So this is the simple test we can do. Also some tests are iron in iron deficiency anemia. We can do the various types of blood tests in detail, so that iron binding capacity and all other things can be seen. So complete blood investigation is advised for knowing the hematological cause. Other investigations are, we can do the urine investigation, we can do the examination of stool to know the bleeding or like that things. X-ray chest can be done for seeing underlying tuberculosis. And common investigation as USG for checking the baby's growth. We can do the ultrasonography. So these are the things which usually we do as an investigation. Complete blood count is the investigation. Detailed hematological study if necessary for the knowing detail about the anemia and cause of anemia. Urine and stool examination if necessary, it is advised. And X-ray chest for usually it is tuberculosis is commonly seen in India like countries, so we can do X-ray chest and USG as a routine thing. These are the investigations of anemia. Now complications of anemia, usually it is complication we should look if there is low hemoglobin count or low blood count, patient will have complications. And the some complications are preeclampsia. It is associated with this anemia, this preeclampsia along with anemia. Second is various types of infections, genital infections as well as various general infections are seen because of anemia. As her hemoglobin level is lowered down, her immunity decreases or immune power is less, and so common viral infections are seen in patient. So various types of infections can be seen along with anemia. And for severe anemia, sometimes if this anemia is not treated properly on time, patient may have severe degree of anemia, and if severe anemia is not treated, then patient may have severe shock, heart failure, or may die. So these are the severe complications of anemia. These are the complications if anemia is not treated on time. So we have to see about the investigation is very simple. We have to do just CBC, complete blood count. Depending on the hemoglobin level, we should monitor the patient. If it is controlled at the grade of mild to moderate, then it's okay. If that anemia is complicated with severe grade, then we have to do the proper emergency treatment, and if not, then patient may die because of heart failure, because of shock, because of the multi-organ failure. So these are the things which we should see for the iron deficiency anemia. Now treatment is, as the anemia is a condition which can be prevented. So the treatment is categorized into prophylactic treatment, that is preventive, and then curative treatment. So in prophylactic treatment or in preventive treatment, first point is proper care of that female or that girl before the pregnancy. Whenever there is chances of planning of pregnancy, we should advise about the minimum requirement or the minimum supplement of iron. So ANC care is very important. We have to advise that patient about the proper supplement or a proper diet. So basically for prevention, we have to advise the patient for proper healthy diet, proper balanced diet. She should take proper nutrients from diet, as we had seen, green vegetables, fruits, and all the things which are rich in the iron, calcium, folic acid, we should advise. So prevention is supplement should be proper, as well as we can give vitamins, iron, calcium, as the dietary supplement, along with capsules or tablets are available, and we can give that supplement. If it is as curative, this is all we can do as a prevention to avoid the anemia, or to stop the anemia at the very mild stage or at the early stage. We can prevent the anemia by dietary supplement and by giving some supplement of iron, calcium, folic acid as tablet form. But in curative, we have to cure the anemia. As in this condition, anemia has been developed and patient is at the lower level of hemoglobin. So we have to cure that patient, and cure treatment is, as we are knowing hemoglobin is decreasing. So we have to maintain the level of hemoglobin by giving oral tablet forms of iron, calcium, folic acid. But if it is not increasing, by giving oral forms, we can give the injectable ions. We can give the injections of iron in IV fluid, and it can be, depending on the hemoglobin level, we can repeat these injections per weekly, per monthly, or depending on the hemoglobin level. So that is the treatment of anemia. Basically, iron therapy is important, either oral form or tablet form. If it is not increasing by tablet form, then we have to give injectable ions. Along with, of course, it is along with the proper diet or balanced diet. We should advise the dietary supplement, as it is very important, because iron loss is continuously seen during pregnancy because of the increasing demand. So by giving injections or tablet also, we have to focus on the diet of patient. So that is about the iron deficiency anemia. Basically, this anemia is very easy to diagnose and very easy to treat. We can diagnose this anemia on simple doing CBC, or we can we can diagnose the anemia on clinical examination also. The pallor is very easy to see, or the edema developed on the lower legs, very easy to diagnose. So anemia is the condition which is very easy to diagnose during pregnancy, and very easy to treat also. By just advising her proper diet, proper rest, proper exercise, proper hygiene during pregnancy, we can avoid many things. So proper diet should be advised during the ANC, and we can treat that patient. If it is not controlling with your proper diet also, we can add some tablet form, and if it is not doing with tablet, we can alter on her injectable form. We can give her injections in IV fluid or in intramuscular injections, but nowadays IV injections are more preferred because they are not painful. Intramuscular injections are very painful. Iron injections are given intramuscularly also, but they should be given deep intramuscular and may cause abscess and all those things. So nowadays we give it by IV fluid. Depending on her hemoglobin, we can adjust the dose. So that is hemoglobin or iron deficiency anemia, which is very common during pregnancy and very easy to diagnose and very simple to